Hi, and welcome to SpondyCast, where we bring together the best medical minds, thought leaders, scientists, patients, and caregivers to inform and inspire the spondylitis community. I'm your host, Jill Miller, living my best spa life, knowing that how we meet today has the power to change everything going forward. Please note that the information provided in this podcast should not be considered medical advice. We do encourage all listeners to consult their healthcare professionals for medical concerns. Thank you for listening, and we hope you find our discussion today enlightening. Hi, and welcome to SpondyCast. Today we're going to talk about thriving later in life, a guide to senior resources, benefits, and support services from a resource specialist at AgingNext. Our guest today is Abigail Pascua. She is a nonprofit leader with over 2 decades of experience in advancing the well-being of older adults, individuals with disabilities, and family caregivers. As CEO of AgingNext, she leads a multi-program organization with a mission to help people live well and age well, safely and independently at home and in the community. Abby played a central role in developing and expanding innovative programs, including volunteer driver and mobility management programs, the Transportation Reimbursement Initiative, and Aging Next Village, one of the first aging in place communities in the region. Under her leadership, the organization has secured a landmark $2 million donation and expanded its memory care center with support from major foundations. Prior to becoming CEO, Abby served as Vice President of Administration and Transportation Services, overseeing a 16-city transportation reimbursement program and building robust partnerships across sectors. Her leadership has consistently elevated the organization's reach, visibility, and sustainability. When not in mission mode, Abby is a devoted mother of 3, a dog mom to a terrier Maltese, Maggie, AgingNext's office dog, and caretaker of Ella, a charming sulcata tortoise. Whether advocating for mobility equity or hosting a volunteer luncheon, she leads with heart, vision, and purpose. I got a little verklempt reading your bio. Welcome to SpondyCast.
Thank you. Thank you. It's such an honor to talk to you, Jill, and be invited at your podcast. So it's truly an honor. Thank you for
This is really
inviting us.
exciting. Okay, so we're going to talk about aging next, and I think this is really great for listeners. And it sounds like there's a lot of synergy in the work that you do and some of the needs that our listeners have. So, can you tell us a little bit about Aging Next?
Absolutely. Yeah. So Aging Next is a nonprofit organization based in Southern California that supports older adults and their families as they navigate aging. Our mission is to support and educate older adults and their families to maintain independence and to age well at home and in the community. And one of our programs out of 6 core programs is the resource specialist. That is truly the one heart of the mission. They're kind of like the navigators, right? When someone calls in, they're often overwhelmed or unsure where to start. Our team listens, asks for the right questions, and connects them with the services or programs and resources that's available to them in their community.
That's amazing. And you're located in
We are
California,
located in Claremont, California. Yes.
Claremont, California. Uh, so, when people do call in to talk to the resource specialist, what are like the most common concerns seniors bring you when they reach out?
It's honestly, most people don't call us when things are calm. They call us when they're already in crisis mode because a lot of times they're not ready yet or something, and they're already like, well, mom just got discharged from the hospital, or a family caregiver is burned out and they're already at their breaking point. We hear, I can't do this anymore, or I didn't know it would get this hard. And that's where resource specialists or our team at Aging Next will step in, not just with a list of options to say, have a pen and paper and we'll give you other phone numbers that you can call, but instead, we offer immediate support and reassurance, because I think that's very important, especially for people who are already emotionally and physically drained, trying to find resources. So, whether it's an emergency respite care or help arranging for transportation or finding in home help, we work fast to ease that pressure and stabilize, like, the situation of I'm in crisis and I don't know what to do.
That's amazing. And it's I'm assuming given the world we live in, you generally would have a high number of chronic illness patients that you're working with, and maybe they're transitioning from I think as you age, transitioning from being able to manage that in home or without a lot of external care. So
Yes.
how do you help in the case of someone that might be seeing, I hate to say it, like age plays a factor in
Mm-hmm.
the evolution of a chronic illness, but how do you support people like that? And two-parter, but like Medicare, Medi-Cal, and getting access there.
So we try immediately, we look at the situation or ask them, okay, what's the current situation? That way we can map out what we need. Or sometimes when people call, they don't know what they
Yeah.
need. They're already overwhelmed where to start, especially for someone who is already living with a chronic condition or is a family caregiver to someone with a chronic condition. So it's whether managing appointment, medication, or mobility management, meaning trying to find local access, whether it's physically or financially. How we help is we offer what is available now and the low hanging fruit of the
Yeah.
services that they can access. And a lot of times, we've been providing services in the last 50 years, especially our transportation program. And you would think that every single person in our local 4 cities that we offer that transportation program, you would think everybody knows about it, and you will be surprised that they don't know. And sometimes knowing those local and easily access, services are just a relief for them. And then we'll go from there, one step at a time.
Yeah, and I imagine, and you'd be a great person to ask this question. In fact, I'm overwhelmed by the way the world has changed. About like my earliest memory of this was probably around 2001 when I called somebody for information at work and they said, "Well, could you go to our website at www." We don't give that information out anymore. Go to our website. And I think there's
Mhm.
a lot of aging people that you're a lifeline on the other side because, I mean, with everything going on in the world, like AI and technology,
Mhm.
I think it gets overwhelming for a lot of people who are older and to be able to call and say, like, here's my problem. I don't even know where to start in solving that. Do you see that a lot?
Oh, absolutely. And, it feels good that you are talking to someone and not just researching. And I've seen this, I've been in this space or working with this organization for 25 years. So the change or the transition from paper to phone to online now, is still people calling for that reassurance, and not just say, we don't give out that information anymore, go to our website. It's still reassuring for them that thank God someone is here willing to help and navigate this journey with me.
For sure.
That's very reassuring for them, knowing that this is not just an 800 and say, press one for this, press two. We tried that. And after like 3 months, when we were like reevaluating our services, it's like, this is more confusing. We are catering to older adults or their families who are already overwhelmed with
Mhm.
the information that they receive, whether it's online or what. And sometimes we have different programs and they're calling the same number
Right.
without realizing they already called us 5 times asking for those five different
Oh
information.
my gosh. That's
Yes,
crazy.
and so
But
reassuring.
it's
Yes.
yeah, I often have a critique of these uh when this happens, it's you want someone to be your client or customer, but you're making it harder for them because the
Overwhelming.
organization has decided they're just going to do what works best for them.
Hmm.
And it's so backwards.
Yeah.
Uh, how many calls do you guys handle a year? Do you know?
We about 2,000 a year, roughly, like
God,
for our 16 cities, and then we also have walk-in clients. We have our case management clients. So, yes, a lot of times we don't even know. You know, it's interesting. The question always, how many calls do you receive? And sometimes one 30-second question, or do you have this? But having a live person actually giving you that information is very like, okay, at least I know I talked to a person and not just I'm only getting one phone number and here I am pressing 10 different numbers just to
right.
get to a live person.
Yeah, that's insane. So when you are, I don't, maybe you guys don't track, or maybe you have an insight here. Uh, are there very underutilized resources available to the community that you serve of 55 and older?
Absolutely. I mean, there are, because a lot of times, again, they don't know where to reach out first. And one of them are like your local community center or your local senior center. Giving them a phone call before you go out and search, like by your county or your municipality. Like, reach out to your local community center first and see what resources are available. A lot of times it happens with us too that they will see something on the paper and they will call and they're like 50 miles away from us and they don't know. So the first thing we will tell them is like, reach out to your local community center and see what local resources are available for you. Or sometimes we will just search that information and give them the right phone number so they can call without this. Oh well, that is good for nothing since they're just telling me to go back on the website and find it
Right,
myself.
right, right, right.
It's like, well, that's not good.
It's
So
a thing.
what we
I mean,
usually do is we'll just find it for them and say, okay, here's the number of your local community center. But start there. Start in your local community center or senior center if you have one. And a lot of times they have those local resources for you.
yeah, you guys must be a lifeline. I mean, you're like a lifeline to some people.
I,
I'm sure of it.
I would say that we are, especially when they are already in that crisis mode and don't know where to start to
Yeah,
ask and
yeah.
overwhelmed.
And beyond community centers, any programs or services you've seen that you like really wish people knew more about that exist out there?
Absolutely. Like for example, the memory care center that we have here in Claremont, and those are respite care programs for the families, their family caregivers, and also for the client itself, with particularly talking about people with dementia. But again, these are like peer based support groups that's available in your local community that may be underutilized just because you don't know where to begin first.
Yeah. And do you find, you know, for patients with spondyloarthritis, we have about 3.2 million in the US, which is a pretty big sample.
Mm-hmm.
But do you find, and where I'm going is like, I think a lot of people with SPA feel lonely on the journey, and
Mm-hmm.
aging is something we're all going to do. And do you find that like when you talk to people that many of them, when they call you, they are feeling like lonely and disconnected, which is crazy considering we're all going to go through this at some point.
Mm-hmm. Well, yes, and social isolation
Yeah.
is an epidemic. That is one of the health issues that we are as Americans are um, really feeling. And we age every day. We age every day, and the loneliness is there. And like there are visiting like local senior companion programs or visiting volunteers or just even a PAL program. For example, the city of Claremont has that is a phone assurance line to just call you and check on you. You know, your
Well,
local community might have that. So call, or here when you call us, even though we're in Claremont, we're not going to tell you we don't know. We'll search it
right.
for you. And we are part of this national movement called the Aging and Disability Resource Connection, where they promote no wrong door policy. Meaning, if you call us, we're not going to tell you we don't know or check the website, but we will navigate and research it for you. And we can go back and check and say, how is that call? How is that phone number that we gave you? Were you able to connect? And if not, let's go back and find another resource for you until we find the right service or the right help.
And what did you call that? The no wrong answer?
No wrong door policy.
No wrong door. I love
Yes,
that.
meaning you can call me. I don't care if you are in Timbuktu or whatever, but it's like, okay,
Right.
we'll find it together. We're not just going to leave you hanging by saying we don't serve your community. We
And
have
listen,
calls.
like the world has gone to this. And there are I could and I'm slowly starting to understand aging just
Hmm.
with myself and parents and all those things. But we have created a world where we put people in a hallway and they don't know. And I mean, frankly, when you look at this on like a retail or like a retail basis, this is what Nordstrom does. You can show
Hmm.
up with shoes from Macy's and they'll take them back and give you money.
Right.
This is, I mean, when you said that, like, it really made me think. I mean, I can't say how many times I've called an insurance company or I've called a company that they just can't give you the answer, and you're like, well, what are you here for?
Hmm.
Like, are you customer service? I and I hear it from my parents too on a lot of as they age. Oh, that is beautiful. This is a national movement.
Yes, it is the Aging and Disability Resource Connection. Here in California, it's really strong. And again, they are practicing that no wrong door policy, meaning again, you call and say, I need this. Sure, we'll find it for you.
Yeah.
We'll connect you. That is the warm handoff, is what we call. That we will not just give you a phone number, we will call for you and find out for you and say, hey, do I have, like, for example, hey, Jill, you're looking for some resources. Okay, great. Do I have permission to give your phone number so I can have this resource or this company give you a call instead you already overwhelmed with probably a page of phone numbers and you don't even know where to start, but instead we will then say, let me have someone from this organization give you a call and connect with you and see if this is the right service for you. We don't just say, you're out of our service area, we can't support you, sorry, bye bye. We don't do that. So we collaborate with
So
other
interesting.
agencies.
And what I love about that is it has to promote for Aging Next, it probably promotes information on hotspots that need to be addressed in the broader community, like in the broader aging community.
Mhm.
And it probably can inform new programming within Claremont,
Uh,
right?
yes, and in the county, like for example, here in our county, the number one issue is housing and transportation. So we build that network. We find resources that is available in the county, or at least uh, for us, we serve 16 cities, and we have that resource available for you when you call. And if it's still not enough, because a lot of times, one perfect example is transportation, where they don't cross county lines. We'll
Oh,
make
yeah.
sure to connect you or give you information as how you can do this. You know, how can we bridge that gap and not just say,
Right.
sorry, this is just on this side of the wall here, and then you find it on the other side. We don't do that. We find the right service, the right resource for you. You mentioned about insurance, like for example, Medicare, or your a lot of older adults 65 and over, or if you have disability and you're covered with Medicare, is whether you're a straight Medicare or you have a supplemental. And that's what's overwhelming a lot of times because they don't know what their coverage is.
Right. This is like the Part D stuff.
Yes, the Part
Yeah.
B, the Part C, what does Medicare, or if I have Scan or Blue Cross, what do they cover? We have resources who can actually explain it to you. It's a matter of fact, we have, I'm going to plug in our conference. We have a Live Well, Age Well conference in September, and that's about planning.
Oh,
What the difference between your Medicare plan and your supplemental insurance. What is the difference between hospice and palliative care, and what are the fraud that's going on inside Medicare. So those are three of the nine topics that we will be discussing with different presenters in our September 5th Live Well Age Well conference.
I love that. Is that online or is it in person?
It's in person.
Great.
Yes.
Okay. Maybe we can share the link.
Yeah, absolutely.
I no, I think that's incredible. And you've probably had much more experience than most of us, but uh, if someone, and I think some of our listeners, whether they're aging or not, can benefit from this. When someone feels overwhelmed or unsure where to begin in looking
Mhm.
for these services, like what would you say to them?
Start with a phone call. Start with a phone call because you don't have to have all the answers. Just start with a phone call, and we're here to help to figure out. They always say, you know, you don't have to be in this crisis mode to call. Start with that, whether you don't know what you're going to ask, and planning ahead prevent that burnout and emergencies. You're not too old, you're not too young to say, I'm not there yet, I don't need it yet. Planning and being
That
informed is crucial.
the planning ahead is huge.
Hmm.
I think it's very unusual for, I don't know if I would split it men versus women, but I might have an inkling of who plans more. Uh,
Yeah, you don't have to be aging. Or if you have a chronic condition, that's equally important. That's critical to your care and how you
yeah,
can live independently.
yeah, and I think it's also maybe you have an insight here, but people moving through the ends of their career and planning into retirement. I am reaching an age where many of my peers are starting to head out on retirement,
Mhm.
and they don't know where to begin, right? They've been in this corporate, gotten their insurance all their lives. And I had a conversation with one recently, a peer of mine who's going to be retiring. And he said, I'm terrified of what's going to happen with insurance when what happens if I have a catastrophic illness when I leave the company?
Mhm.
And it's a real fear. And some of it is just, right? We fear what we don't know.
Right. Yeah, absolutely. And again, one of the topics that we are going to be covering is it too late, to invest? Is it too late to plan now that I am, approaching retirement age? What else is available for me to prepare
Right.
that? Talking about insurance, talking about healthcare, that could be costly,
Right.
as you reach 55 and over or 65, but it can go even more when you already have an underlying health condition. If you
For sure.
already have that chronic disease, then how much more do you need to retire comfortably? So those are the questions that you want to ask yourself in being prepared. That way you're not reaching that stage, and then that's when you're going to say, now what? What do I need now? Now that I am already here in this stage in my life that I want to live comfortably, live well, and age well, but
Right.
my resources are limited.
Right. And it's a transition too of your
Yes,
universe.
yes.
It's I think of, the pain I'm going through when kids go off to college. That's a
Hmm.
transition. But it's on the back end too, you may be losing some of your anchors. So uh tell me, uh generally when people call, like, is there a protocol for the way a conversation looks?
I think the most important, I know when the question is like, how is that? What is the script or something? I think the most important thing is to listen, because a lot of them don't know what they're trying to ask. They don't really
Right.
know what the goal of the call is. And so the most important thing is for us as resource specialists here at Aging Next, the most important is listening, because then you can dive in more when you start. That's where the start of the conversation and finding the right resource. Because sometimes when they call here, again, they're confused, they're on a crisis mode, or they just simply overwhelmed with everything.
Yeah.
And sometimes they just need that person on the other end to listen. It's very interesting in, how, in the years that we've been taking phone calls, and a lot of times they're just lonely and they don't know what to ask or what they need. And
Yeah,
knowing that someone on that other end is willing to listen is very important.
yeah, I used to be in sales and I used to say, our goal in sales, and it's probably the same for you, is whether or not the person on the other side of the table is saying it, you have to hear them telling you what hurts, or you can never fix it.
Right.
Yeah, it's very much, I think it's probably like a care protocol as well that we could do better with sometimes.
Yes.
Uh, uh, so in your work at Aging Next, what do you think some of the biggest general misconceptions are about uh, aging or getting support as an aging adult?
That we are not aging, that we don't need the service yet, or we are not there yet. It makes me laugh every time with our name Aging Next. When we were out there in the community, they will see our banner and it says Aging Next. And it sounds like, a disease that you can avoid. And it's like, no, we don't need it yet. I'm not old yet. And it's like, well, you don't have to be old. We actually don't want you to be old and then finding us, because a lot of times it's already too late. Again, going back to that crisis mode and lack of planning. We age
Yeah,
every day,
sure.
from the moment you're born, you're aging every day. But
Yes.
now that we are closer and need those services in your support group, and I'll plug in the Aging Next Village or promote our own social, rebuilding your social network, rebuilding your circle of friends, because a lot of times loved ones, pass away or your families move out of the area. So it's time for you to reconnect, to reinvent that circle. That's the most important thing, because we always say, I want to live independently. I want to live well at home, regardless of how you define home, whether it's an apartment, whether it's a retirement community. What's next for you? You know?
Yeah, but you're right. I think and the social connection is huge. I know I've been doing a little bit of research on like Singapore and how Singapore, if you're aging, uh, there's government subsidies to bring people from your social network closer to you,
Mm-hmm.
living, because you survive longer. And uh, you're making me think a lot about my parents. So sorry, I'm being a little selfish,
No, that's true.
but it's really interesting. And I've watched even, I think it goes for the same with a community around like spondyloarthritis, and especially as we age as patients. It's I think of it. I was with my family and some of my older aunts and my mom's cousins a couple weeks ago, and I always say when I go to the gym, I always say I want to look or I want to feel this good when I'm 80. And
Mm-hmm.
my mom belongs to like two gyms. She might belong to three gyms.
Oh, wow.
And but she and her silver sneakers, and she rounds up all the cousins and all the sisters, and she's like, we're going to yoga and we're doing this. And she's always saying, these people have got to get out. We have to get out. But I think we do have to encourage each other because it's so easy to go the other direction. And we're all going to move through it. And there's no shame in it. And I've officially stopped using the word anti-aging and used pro-aging. so, uh, so what do you think? And you have probably a really unique view on this. Uh, what do you think makes a program or a service that is offered like really impactful for older adults and their caregivers and families?
For me, I think the most impactful services are the ones that are personal, accessible, and respectful. Programs that meet people where they are, culturally, emotionally, financially, and create that trust. So I think that's the most important because that's where what it will lead you to real impact. That connection, I think that's the most important in handing someone that, not just brochure and say, here you go, good luck to you. It's about
Right.
walking the path with them and say, let's navigate this journey together. Let us
Oh,
empower
uh,
you and what those services, are needed and how we can partner with you in reaching that goal.
I love that. Uh, how do you help family members to support loved ones in accessing resources and any advice there?
Yes, I think it's all started with going back to conversation. I think that's the most important thing, that start the conversation with empathy and curiosity,
Yeah.
and ask them what would help you feel more supported, or what do you worry most about, like right now.
Yeah.
Those are encouraging, that at least someone, they feel like, okay, I can talk. It's not just about the service, but also how I feel right now, and always remember to remind that they need to care for themselves too. That's the most
Yeah.
important. You cannot, what did they say? You cannot pour from an empty, um, glass. You can't do that,
Yeah. It's true.
you know.
Most of us have been there.
Right? Yes, and I will never forget about that. And it's so interesting. That how can you help if you alone yourself is drained? Like the airplane, when they say that your oxygen mask, you have to put your on first before you help another person. So
Yeah,
that's very important too.
it is. I think it's a tough lesson to learn sometimes when you care about someone.
Very tough, right?
Yeah, and I know Aging Next is based in California, though you guys have a no wrong door policy, which is beautiful. I want to like hug whoever came up with that. Uh, but what do you suggest for people outside LA who may want to find different resources or a national organization? Is there anything that parallels the work you do?
Yes, I think when you reach out to your local area agency on aging, or your 211, or again, reach out to your local community center or senior center and just check on what's available. For sure, they can guide you to right resource. And then from there, you can call us. You can reach us and we can find resources for you. I'm not kidding because we used to have one, and the sister who is caregiving from afar is from Spain. How they got
Oh,
our phone number, and we get to enroll their loved one here at our memory care center. And she used to call us every week to check on her brother, but from Spain. And
that's
then
amazing.
brother is calling here, so there's, we're just a phone call away. Or again, reach out to your local area agency on aging or community center and check what services are available in your community.
I love that. You guys are so inclusive. It's amazing. Uh, Last question. Uh, what is your big hope in the world for how we age going forward?
That age is not a threat. We are aging. It's not a threat. It's all about how you will live well and age well through planning. That's the most important thing.
That's
We don't
beautiful.
walk away from it. You cannot run away from it. You close your eyes and tomorrow you're one day older.
I know. Believe me. Believe me. I know. Uh,
you know, and that's
no, I think that's
important.
beautiful. Yeah. Did we miss anything that we wanted to talk about? I
I
don't
don't
think
think we
so.
missed anything. I think I wanted to share about that, whether you're aging or not, or you're 55 and over, and just want to know. We have this document, and maybe I'll send it to um, Jason. It's called the 25 documents. And all
Oh,
those things that you want to plan. It doesn't matter if you're 45, it doesn't matter if you own your home or if you have a chronic condition. All those things that you want to be in place.
oh, I love that.
It's so interesting. My kids, I have um, three. One is 25, one is 19. And it's so easy to say, I don't need it, or what is it? Again, educating your loved one, because planning and being prepared is the greatest gift that you can give them. When I was giving birth, and it's like, do you have an advanced care directive? In my head, I was 23. In my head, how stupid could this nurse be asking me advanced care directive? I'm just giving birth. But then I
Right.
realized that it's like, if something happens to me, the greatest gift I can give my significant other would be that I am prepared, that there is something in place. Because that's the
Yeah.
emotional crisis is hard.
Yeah, it is. I had a friend recently telling me of a situation she went through with a sibling, and a lot of these things were not in place. And her sibling passed away, and as her parents aged, she finally had to go to her parents and say, I need you to love me enough to do these things so that I don't have to bear the burden of what I already have taken on. And I think it is. And I think certainly people who are aging definitely will have uh, struggles. Any of us will have struggles with giving up control and like letting letting other people take care of us. But yeah, I think it's a sign of love when we take care of it, like when we give that to our loved ones.
Oh, yes,
Yeah,
absolutely. Knowing that you
yeah.
don't have to have that emotion. It's so hard to decide when emotions are,
Ooh,
through the roof.
yeah,
You don't know. But if those documents are already in place,
yeah.
and your wishes are being respected, are being
Right,
carried out, and at the end, you're still in control of yourself. Because we always
right,
say, I want to be in control of myself. But when
right.
we walk away, it's a little, it's like, I want to be in control, but I'm not ready to face all these things that will empower me to be in control.
I love it. That is a perfect place to Aging Next is a place to become empowered.
Yes, absolutely.
Well, thank you so much for taking the time. This was lovely to speak with you, and I learned a lot. I hope our listeners did too. And yeah, best of luck. And thank you for all the work you do. It's really inspiring.
Again, thank you for having me, Jill. It's so nice to meet you. And, if you don't have to live in Southern California, you can call us 909-621-9900 or reach out to through our website and send us an email, and we'll definitely find the right resource for you.
I love that. Thank you.
Thank you so much.
SpondyCast was made possible by donations from the Spondylitis Association of America's individual members and our show's corporate sponsor, AbbVie. Since our founding in 1983, the Spondylitis Association of America has been the face, voice, and leading nationwide nonprofit educating, empowering, and advocating for people living with spondyloarthritis. Through our extensive work with patients, the medical community, and partners, we provide information and resources to help people impacted by the disease live better lives and champion research to find a cure.